Healthspan is not just a personal revolution, it's a societal revolution. So, Bernie, beyond the individual, what does this mean for society?
Well, Healthspan is a reality. It is the future, and it's also a state of mind. All right. So what does it mean for society? The loftiest goal, taking all of the future medicine technologies and the new technologies at hand, putting it together to create a healthier world, a happier world, a more productive world. I can't think of a movement that captures so much of the essence of what's good about life and what's good about the human spirit is we live long, healthy lives, not burdened by crippling diseases, not burdened by pain and suffering, but good health to be able to accomplish good things and to make the world work better.
If we want to get this movement to the point where we're doing what will delight, what will move the needle policy-wise, economically, and communications-wise with the public, we need all of those different types of people and their reasons behind what they're doing to be part of the conversation, whether it's patient advocates or scientists or people in industry or wanting to build an industry around this or grow the existing biomedical industry with interventions from this science, and also people that are just interested in it for their own health and because they're curious about it. We need all of those working in unison. The passion behind wanting to find better treatments and cures for those diseases, the coalition of patient advocacy organizations that Bernie spoke about earlier, were the reason that we were able to get Prop 71 passed and create that state agency to fund the science in California. And Bernie and I had a front row seat. We watched this field develop, and for the first few years, before the executive order was able to be reversed and the NIH was able to start funding embryonic stem cell research again, California was the only game in town. We never would have been able to get the field as quickly to the point. It's very fast for the way science works, to the point where we actually have clinical trials for cellular therapies to try and cure diabetes, Parkinson's, ALS. This is happening. It feels like science fiction to me still, even though I was right there when we were starting. That wouldn't have happened without a coalition of patient advocates wanting it to happen. Where is that going to come from if it's too big of a burden? If it's too many people that are too sick? If we could just find a cure for one of the diseases considered a disease of aging, Parkinson's or Alzheimer's at the top of the list only because of the number of people that suffer with them, we would be saving hundreds of billions of dollars in healthcare costs. And I'll stop there.
All I have to add is just understand, Junaid, that it's the power of narrative. As a lawyer, when you present the case in court, don't tell the public this, but it's basically show and tell with rules. And what do you show? You show a human being, you explain a story. It's a narrative. And the patient narrative is the most important narrative. And if folks want to see an example of a patient narrative, it's Christopher Reeve's statement to the United Nations. I was sitting on a sofa across from him. We worked on the script together. I was never so moved. I was 18 months from the practice of law and being a full-time patient advocate. He got it. He knew how to speak to the camera and make it understandable and explain to the people in the United Nations and the countries of the world the importance of hope.
Investing in prevention and health span research, it could literally change everything, right? But it's also about economic opportunity. There's a massive market that's emerging for solutions that can actually improve health span. There's an inflection point where there's enough of the stack where wherever that science fiction part was before the stack, it's now there ready to take off. There is that light at the end of the tunnel. And I think with the Healthspan Action Coalition, being a part of that is what's going to move us toward that light, right? We're going to move toward that light and live in a world where we always should have been.